Today we're with Rachel Gonzales-Hanson, who is the CEO of Community Health Development, Inc. In Uvalde, Texas, for the gringos, Uvalde. And you've been with CHDI for how long?
36 years since we started.
Wow. But you didn't start as staff at CHDI.
No.
You started?
I started as one of the original board members, and I was actually a patient representative on the board.
So you were getting your care from CHDI.
After we opened, we did. Yeah,
Wow.
we certainly did. And before that, that was the problem, right? We couldn't get our health care. I had 2 children. I was a single parent. And sometimes we qualified for Medicaid, but the doctors didn't accept Medicaid patients because Medicaid wasn't paying. And so sometimes we didn't qualify for Medicaid because I made a couple of dollars too much a month.
Yeah.
And so it didn't matter because I didn't have the money to take them to the doctors anyway, right? So we did some remedios, right? Some home remedies. And we ended up in the ER a few times.
Oh,
of course,
boy.
that was more expensive for everybody,
Yeah.
right? All the way around. But that's part of the impetus of what happened with getting CHDI started.
And you found others in the community who felt the same way?
Oh my goodness, Dan! Some of the stories that we had from the beginnings of our story, of our historia, when you had pregnant females, called the ambulance because they were in labor, and they show up to the emergency room, and at the emergency room door, they're stopped by the ER nurse and said, "What do you have?" And they said, "Well, we have a pregnant woman in labor." I said, "Well, does she have insurance?" "Well, no." "Does she have any money?" "Well, no." "Does she have a doctor?" "Well, no." "Well, we're not going to see you." So this was
This
at a
from
time,
the local hospital?
the local hospital, and that actually had a Hill-Burton obligation. So for those of us that are old enough to remember what a Hill-Burton obligation was, is the feds would give federal dollars to the hospitals for capital projects and equipment and so on. And in exchange for that, you saw those in need. You saw the poor patients,
Sure.
right? Well, they were turning them away. And so they would wait in the ambulance. The EMT, who were volunteers, and the patient were waiting in the ambulance until the baby crowned. And then they knocked on the ER door again and said, "Hey, the baby's crowning." And the nurse would say, "I guess bring him in now." So what's wrong with that picture? Would you rather have the baby when you're trying to control the situation, right? Or in this case, afterwards when so many things could go wrong for the baby and the mama. So just horrible kinds of stories that would go on. And we had a couple of county commissioners, the first 2 that were elected as Hispanic county commissioners in our area. It worked with the city manager at the time to write a grant to get funded for a community health center, like the one down the highway, because we thought if they could get one, we could get one.
Down the highway
In Texas, so it would have been in Crystal City, Texas.
Yeah.
So Vida Salud Health Systems.
Yeah.
Yeah.
So you wanted to be like those guys?
We wanted to
gals.
be like them. We wanted to have the access to health care that our patients and our community deserved.
And the grant eventually got funded, right?
Well, that's another story. So there was actually a grant submitted even before the one that did get funded, and these were tough times back in those days, back in in the 60s and 70s in Uvalde, Texas. So the initial grant that was written prior to the one that got funded, actually had been approved and received. It was like $1 million grant, and one call from a local doctor to a former governor from Uvalde, Texas, who called higher up and said, "Kill it," and they killed it.
They did.
And so 2 years later, about 2.5 years later, this other grant was written that got funded. So we got money. We applied for migrant and community health center funding, but they only allowed us money for migrant health centers, and the grant was for $193,187.
Wow, you remember the amount.
I remember the amount because we weren't quite sure how we were going to do it.
With that little money, yeah.
Right.
Even
right.
back in those days.
But
That
what
wasn't a
helped,
whole lot.
that's exactly right. But what helped a lot was the city and the county were being very supportive. So the city kicked in some money saying, until you get more federal dollars, we'll continue to support. The county just kicked in money and said, we're going to continue to support. So but with those dollars, we were able to see other than agricultural workers, right? So we were able to see the community as a whole. And we made it through. We did obviously some billing. We learned how to bill and we learned how to do all of those things. And we had a lot of help from surrounding health centers to get our infrastructure in place.
That's great.
And that's the culture of the health centers, right? Sharing with each other.
Yeah, you do what
Best
you can
practices.
and share with others, right?
Exactly.
And get the community engaged.
That's right.
Speaking of community, so you began as a volunteer and a board member.
I did. I did. So one of the county commissioners that was that wrote the grant, and he was working on getting a board of directors together. I actually knew him from school, but also from his campaign. So we helped with his campaign when he was running for county commissioner. And so when he was working on this, he called and said, "Where do you get your health care?" And I said, I sort of repeated the story I said earlier. I said, "It's hard. It's really hard." And he knew I had 2 children and that I was a single parent and I lived in the projects. And he said, "Well, we're going to start a health center." I said, "Great." I said, "What's a health center?" And so he was telling me about what the health center does. And I said, "Okay." I said, "That's wonderful." He goes, "Well, we need some board members. Do you want to be on the board? You can represent the patients because you probably use it." I said, "Yeah, I'll do it." So we hung up, and then I sort of thought to myself, what is a board of directors? And what did I get myself into?
What are we supposed to do?
What are we supposed to do with this? So under his mentorship and a few others that were involved, several others, we learned what a board does. We learned about our responsibilities, not only to the health center, but more importantly to the funding sources, and even more importantly to the community. Because we are supposed to be responsive to the community. Yeah.
That must have been quite the undertaking. So that was as a board member.
Right.
But later you transitioned to staff.
So yes, we were incorporated in May of 1983. And
Okay.
so we were on the board and working through processes and trying to get systems in place and hiring some staff. In December of that year, we hired an executive director who was also a PA. So we were trying to, because we knew it was going to be a very small number of staff,
Sure.
people had to wear multiple hats, right? So this young man that was the first director was great. He built a great clinical foundation that we have built on since then. So we hired him in December, and then they said, well, we need an executive secretary that's going to work for his administrative staff support, but also bill patients in the front and collect and help register and so on. And so a couple of the board members said, why don't you apply for that? And I said, well, I'll think about it. And they said, well, we'll have benefits. And I needed benefits. I said,
could use a
okay.
job.
Exactly. I said, well,
You
let me
have
get
health
off
insurance.
That's right. So let me get off the board. I'll resign from the board and apply. And so I did. And I was privileged to and blessed to get the position. So I started as the executive secretary. And then a couple of years later, the executive director decided he wanted to go back to school to try to become a doctor. And so then I became the interim director, and then they had their interviews and recruiting for a new executive director, and I said, I'm going to try. So I did, and lo and behold, God opened a door, and I ran through it, and here we are.
What a great story. All right, so when you started as the executive director of the health center, you must have been like a one-armed paper hanger with the hives. How many different tasks and must-dos did you face, and what were the top priorities you had to tackle?
The top priority
early
was
days?
finding doctors. When we first started, we actually were using the physicians that staffed the ER for the local hospital. It was a little agreement that was made to try to get our foot in the door and opened, right? And so we made a little agreement with the hospital. And
This is the same hospital that used to turn away pregnant women.
That's exactly
unless
right.
the baby's head was crowning.
That's exactly right. And looking back, it's interesting, but we've learned that we have to play their games We just have to be smarter at it and play it better. And so looking back, this is actually what the board did. And I learned from that and I carry that forward. And so they decided that, look, we need a little bit of help. Let's partner with the hospital to do some stuff, gets our foot in the door, gets our doors open. And then and then when we're ready, we pull off, And so that's what happened. So we were contracting with them for the physicians, but remember we had the PA.
That's right.
That was seeing the patients. So
yeah.
he saw patients during the day. And we did admin work in the afternoons.
He saw patients while he was going to medical school.
Well, no. This is when he's still a PA at the very beginning, right? This was at the very beginning.
Yeah.
So when he was going to go off to medical school, then I needed to find a doctor, and we had already sort of pulled away from the doctors at the hospital, from the ER doctors.
Yeah.
And so finding doctors, we used locum tenens at the beginning, as everybody does, and it was, of course, eating our lunch, but we had no other choice. I think at that point we had grown to maybe a staff of about 12. So we had a couple of nurses, we had a couple of front office people, we had an assistant, and then we were trying to, some nurses, we had a couple of nurses, and so we were trying to find the doctors. So lo and behold, if I don't get a letter one day from the feds that says, we're shutting you down in 3 months because you have not been seeing patients. And yet we had submitted our BCRR, do you remember that?
Oh, I certainly do.
The precursor to the UDS. We'd submitted it, we had been actually meeting good productivity numbers, but somebody couldn't read the grant. That's I don't know what other explanation I could have, right?
Illiterate bureaucrats.
I guess, I'm not sure. So I also got a phone call from our state association director, Jose Camacho, and said, Rachel, Sonia Leon Rig just called and said, you guys are about to get shut down. I said, yes, I'm reading this letter. I said, they can't read the grant. He goes, are y'all seeing patients? I said, yes, and it's costing us an arm and a leg because we're using locum tenens. I said, but we are seeing patients. And so we gave him the information, we gave it to Sonia, who was a Fed at the time, remember, in charge of the migrant health program.
Sure.
So we affectionately call her our madrina since then. Because of that, Jose says, you need to go to the National Association of Community Health Centers conference that's coming up in Florida next month, and we need to meet with Dick Boer, and we need to fight and tell him that you are seeing patients and they need to back off. I said, okay. What is the National Association of Community Health Centers?
You'd never heard of it before.
I had not, because I'd only been as the head for, I don't know, less than a year, right?
Sure.
And so I was busy trying to get my stuff in place, and I barely knew about the state association. So now there's a national association, right? And I'm like, we're doing it, let's go. And so we went to Florida and couldn't get a meeting with Dick, so we corralled him at the bar. And I know Jose's going to kill me, and so is Dick.
Yeah.
And so is Dick for sharing this story. But we corralled him at the bar, and Jose says, "You're on." And so I said, "I don't understand what's wrong with your people. Why can't they read a grant?" I had no idea who Dick Boer was or why I was talking, but I knew I had to talk to him. Didn't realize he was in charge of the money. But I just went at it my way. And I said, what is the problem? Because here's the grant. It says clearly we're seeing patients. It says the number. We've submitted our BCRR. Our data compares to others that have regular physicians on staff. I said, so why are you shutting us down? And he sort of looked at it and he laughed a little bit and he goes, okay, we'll talk about it. We'll call you. I said, when? And so we went through this back and forth until finally we set up a definite time to talk on the phone. Then when I came back and I told the board, it's like, well, what do you think you need to do? And so we talked about it and we decided we're calling every elected official we know that represents us to bombard the Bureau to say, do not, defund them, right? Do not shut them down. And so back then it was Abraham Chick Kazin. That was our congressman. I remember him. And Lloyd Benson was our senator.
Yeah.
Man, we go back, right, with those days. And we called Chick Hazen's office, who helped us get started. We called Lloyd Benson's office. They all made calls. I remember it was in December when I get a call from one of the feds calling me back and said, Rachel, I said, yes. Goes, this is so-and-so from the Bureau. And I do want to talk to you about your grant application. I said, oh, the one you want to defend? They said, yes, well, we're looking at it again. I said, good. And they said, but before we start, how many more calls are we going to get from your elected officials? Because we'd had about 7 or 8 call because they called us back and said, I just talked to so-and-so. They're on it. They gave us this list of who all they'd been talking to. And so I said, well, tell me who's called and I'll tell you who's left. And and so I don't know how I didn't get defunded just because of my attitude, but God was helping me out, thank God.
You were feisty, good.
Well, I just wasn't quite sure why they were shutting us down, and I knew what my patients needed. I knew what our community needed. And if we were going down, we were going down fighting. So needless to say, it didn't happen. And we thank God for that. But we thank God for some gutsy board members, too, who said, let's try this, let's try that. And they taught me so much in that one situation that we had to deal with that has stuck with me, Dan, the entire time. So aside from the fact that I'm already rather rowdy and feisty, that just added more fuel to my fire. I'm saying just keep doing it, and that's what gets things done.
It is what gets things done. It's people power.
It is.
We've never been, the health center movement, the family, the community, have never been a moneyed group. We've never had money to throw at a problem. The one thing we've had is people, a whole army of people.
That's right. And and the story was so poignant back then, it's even more so today with what's going on and the fact that we have to fight for our fiscal cliff. We have to avoid the fiscal cliff. We have to fight for our grants every year. So those examples need to serve as excellent best practices, if you will, and I know there's millions of them out there.
Sure.
I'm not the only one. And they are what's going to get us over the goal line every time. So it is really the people back home and our elected officials that truly know why we're valued.
Yeah, absolutely. Well, you've overcome some incredible obstacles, but those obstacles, bumps in the road, you've encountered them pretty consistently. We all have over the years.
Sure.
So after you overcame the obstacle and managed to keep your funding, what were the other major challenges that you and CHDI faced?
Again, the providers, trying to make sure that we had providers, trying to manage the number of patients that needed to be seen, trying to make sure that that they were able to afford their pharmacy. When we first started, we actually had vouchers that we gave to them to take to the private pharmacists in town to get their prescriptions filled, because if you can't get your prescription filled, what's the point of coming to the doctor, right? But 1 year, Dan, I remember 1 year we went through $100,000 in our line item budget in 4 months for pharmacy.
For pharmacy, yeah.
When it used to last us a whole year, right? And so around that time, we had our state association working on group purchasing, and the first thing they started working on were the medications and the pharmaceutical products. And we were one of the first ones that opened up a Class D pharmacy. Because of that, we had run out of money, and it went so well, and it was so inexpensive that it was cheaper for us to not apply a sliding fee scale to that service, but rather to sell it at cost with a little bit of overhead to cover our overhead, right? So I remember the first prescription we sold was for thyroid medications. And so on the market back in those days, maybe it was a 30-day supply of thyroid medication, maybe $25, $30.
Yep.
We sold our first one, it was 90 days supply for $2.33. 33 cents was the medication and $2 was the overhead.
Wow.
And so
Suddenly you realize that the pharmacies are making off like bandits.
Exactly. And more importantly, our patients were able to afford it. Again, we didn't apply the sliding fee. We just gave it to them at cost plus that overhead. We never had one complaint. And the patients were able to pay.
It was, it does remind me when I was 5 years into my period as head of Su Clínica Familiar, and the exact same thing. The pharmacy bills were eating us alive.
Yeah.
the key here was, and we knew we needed to take the pharmacy in-house.
Right.
We needed to hire pharmacists. We needed to set up space. We already had little closets that we designated
Right.
as dispensaries.
Yes.
But that was not enough. My challenge was I had two pharmacists on the board of directors.
Oh
And
my.
they were the
Yes.
locals, and they had, as you can imagine, they had a very direct interest in this. And I remember I spent 4 months working them over. And when the vote finally came on the board of directors, one of them made the motion, the other one seconded it. Take the
Really?
pharmaceutical services in-house.
Oh my
Yeah,
gosh.
it was just appealing to them, their
their
sense
heart,
of,
maybe,
yeah,
right?
of appropriateness and their sense of being of the community and serving the community.
Right.
And they did. They finally, and both of them lost a fair amount of business as a result.
Sure.
But it was crucial. And I'm sure that's essentially what you went through there as well.
We've been through a couple of times because we do have a healthcare representative on our board. We've had a standing position for that all along, and so we've had someone from the hospital on our board over the years. We've had a pharmacist now, actually, and we've had a physical therapist on the board. We've had a doctor. Actually, a doctor was a founding member who went against the rest of the medical staff. And that was really interesting.
Wow.
But this guy came to Uvalde after working in the Indian Health Service. So he set up private practice in Uvalde, and he said, I want to be part of this, and he understood. And he was a very well-respected and very loved doctor. So the others sort of kept at arm's length about that. But he got some slack. He got some slack.
He did, but he probably, his support was crucial, no?
Very much. It was very
the
crucial.
success.
And there was, interestingly enough, there was an older physician that was there. His name was Dr. Sterling Fly, that was one of the original incorporators as well. And so he was in private practice, but what he wanted to make sure was that everybody could get health care. He was old school doctor
Yeah.
that really believed in serving the community, right? And I affectionately called him the godfather of the medical staff because he was definitely one that if he said something and it didn't matter who or how many disagreed with him on the medical staff, no one said a word. They were all just very quiet, nobody bucked him. So the godfather helped us out quite a bit.
That's wonderful.
Yeah.
It is the story in different ways of so
Yes.
many different health centers.
Absolutely.
It's kind of like that old TV show, The Naked City. There are 8 million stories in the Naked City. This is one of them.
Absolutely.
And each one's unique. Yours is your story, your personal story, and that of CHDI are incredibly unique and special in the health center history.
We've been very, very blessed, and we're in rural Texas, so we've had our fair share of challenges and then some, but somehow, as I keep saying, necessity is the mother of invention, and in rural Texas, we tend to invent a lot of things that we need to get things done, and sometimes most of the time it turns out well, and once in a while we get a slap on the hand, and I don't know, sometimes it's better to ask for forgiveness after the fact because we're doing the right thing.
Sure, absolutely.
Yeah.
But you have also been a real, not only a practitioner, but a leader in the notion of community. The Texas Association, the National Association, you've held virtually every position of importance in those organizations, not because you ran for yourself, but because you represented
Right.
the community you serve and the community of health centers in Texas.
Right.
Tell us what the experience with TAC and NAC has been like for you.
Well, the experience at TAC was interesting when it started, and it had its challenges. It was a male-dominated world,
Oh, yes.
and certainly the Hispanic female there weren't a lot of us, right? But, I think one of the things that I learned from my board when we first started, and again, very, very forward-thinking board members that said, Rachel, you're not going to bring resources to our area by sitting behind a desk. Build your team, build a strong foundation, be mindful of the budget, and get out of here and go get some resources and bring them home. And so that has been a driver, and I've been fortunate that all along our board has had that same way of thinking, because they're right. Foundations are going to give in big cities for the most part, right? Who cares about Uvalde or Lakey or Campwood, Texas, or Batesville, Texas, or La Pryor, Texas, unless we tell them to care, right?
Sure.
So again, as you said, we served agricultural workers, we served the rural areas. We wanted to make sure that people cared enough that they put enough resources into our communities, and you can't do that unless you have that voice, unless you have a commitment to saying the same thing with one voice. And I wanted to make sure that rural and agricultural workers were part of that one voice, and then that message that was being said. So, troublemaker that I am, and quite honestly, with the blessing of a lot of mentors in our health center movement that have helped me along and shown me so many things and taught me so many things, and the fact that I listened and the fact that God put those mentors in front of me is why I believe I've been able to do what I've been able to do to date. So they were wonderful experiences. I take them all as learning experiences. Yes, they had their challenges, and I often wonder, and I look back like, why the heck did I do that? But I also say, my God, if I hadn't done that, what would not have happened, right? But all of us need to think that way, and all of us probably do, because we're in it for the right reason.
Sure.
Right? We're in it about helping our community and helping all of the patients across the country, making our country better.
Yeah.
So when our passion is there and it comes through, then, and if we stay true to our mission, the mission is always first.
That is crucial.
The mission is always first. The patients are always first. Then the rest comes, and we're put into different positions to help different ways with the gifts that we were given. And so I've been blessed to be able to be part of it. And I only hope that I've been able to give back at least half of what I've gotten out of it.
Size is not the only measure of success.
No.
But at Uvalde, you started with a handful of staff, one site, and a few hundred patients back when you began as CEO. How has Uvalde CHDI grown over the years? Where's it at today?
So now we're at about a $10 million operating budget. Mm-hmm. We have 5 sites, 3 in Uvalde and 2 in the foot of the hill country, in 2 little communities, Lakey and Campwood. We have medical, dental, behavioral health, pharmacy, lab, x-ray, a teaching kitchen, a fitness center, and our budget supports about 130 staff. And we serve, in our area, it's about 3.5 counties, which are bigger than the size of the state of New Jersey.
Wow.
Which you taught me, by the way. I remember that.
Yeah.
You were giving a testimony one time to Congress and said, "Do you realize how big your area is?" It's like, no, tell me. So that's a good size, right?
Yes, it is.
But the population, más o menos about 30,000, and we see almost 11,000. So we see a third of the entire population of our area. And we create jobs. We're a big job creator. Obviously, the economic impact that goes into that. So we have earned, I believe, the respect of the community, especially the leaders, our elected officials at the local level, all, thank God, are all very supportive, to the point that we don't even have to go before the county to see if we're gonna get our continued funding or not. The city gives us money now as well again. And there we still have to go, but when we go and present, they never ask about us, they ask about what's going on with the hospital or what's going on with the healthcare industry in the country. Yeah. So we're a resource, we're viewed as a resource. And so to be able to have that kind of a footprint, is good. It's good for our health center because that way we will continue to grow.
Yeah. And speaking of support, I remember Henry Bonilla singing your praises.
Oh my gosh.
And of course, he became a champion
Yes.
of health centers in the Congress.
Absolutely.
And I loved how he used to put it that his district included more cattle than people.
Yeah.
Ran all the way up to almost El Paso.
Yes.
And he's been wonderful. He moved on, and Will Hurd, who replaced him, has been also a strong champion
Yes, he has.
for health centers. And now Will's moving on.
He is. We're really sorry that he's leaving, but he told us at Health Center Week last week, I guess, he told us he committed, he was there at the health center in front of several elected officials from the entire region, because we had a town hall meeting, and he committed to helping us for as long as he was in office. So for the next 14 months, I guess it is, he said he was ours. So we're going to hold him to it.
That's great. That's fantastic. And I'm sure that whoever is elected to replace him will also become a true champion.
We hope so. We're
No,
gonna keep teaching him.
It's you personally. It's the great successful program that you run. It's all of your people, your staff, your patients, your board, your community support. You have been and are today one of the greatest heroes of the health center movement.
Oh, Dan, you're very generous, and I don't know about that, but we can't do what we do if it's not for our staff back home.
Yeah.
They're the heroes. They make it happen.
Yeah,
We just get to brag about it. And then we sing their praises, we give the stories, we show the examples, and that's what gives us credibility.
Yeah.
They're the heroes.
What a story. What a life story. What a life well spent. Oh no, what you've given to the community, you've received in kind 1,000 times over in return.
Oh my God,
People
yes.
love you there.
Well,
And you have done so much for them over the years.
it's been my honor.
That's how people should feel. It's an honor to serve.
It is an honor to serve.
Yeah.
Yeah. It's not about entitlement. It's not about what I've earned, or it's about what did we give back to make our community better. Because if the community's better, then we're all the better for it.
Sure.
It takes all of us.
All right, hon. We
Thank
love
you. Love you.